we move to the essential part of the speaker, let me introduce you our speaker. We have Prima Kusrini. So Prima is a midwife at a regional general hospital in Indonesia and a postgraduate student in midwifery at Pajajaran University Indonesia with interest in adolescent reproductive health and maternal mental health. And we also have Karita Aulia Tama. So she is a midwife and graduate of Universitas Andalas, currently pursuing a master degree in midwifery at Universitas Pajajaran. Oh, so Prima and Karita is a classmate with a focus on public health and community-based midwifery. So, um, time is yours. I will give you the remote control. Okay, Karita first. I will give the remote control to Karita. Yep. Time is yours, Karita.
Okay, thank you, Kak Izza. Please, Mbak Prima.
Thank you, Kak Izza, for introducing us. Good morning, everyone. Can you hear my voice?
Yep, really good.
Yes, thank you. Good morning, everyone. My name is Prima Kusrini and my partner Karita Aulia Tama. Today we are thrilled here to present our review study about the determinant of adverse pregnancy outcomes in adolescent, a review study. Before we dive in, here's a quick look at what we'll be covering today. We'll start with an introduction to the problem, and then why it matters and our research objective. Then we'll discuss our methodology, key findings related to maternal and perinatal outcomes, risk factor, and finally our conclusion and recommendation. Okay, for the introduction, adolescent pregnancies is a significant global health issue with substantial negative impacts on both maternal and newborn health. Beyond the medical concern, there are also considerable economic and social stability consequences that affect community globally. As we can see from our data, our global data in 2019, approximately 21 million pregnancies occur annually among adolescents aged 15 to 19 in low and middle income countries, with roughly half being unintended and leading to about 12 million of births. Alarmingly, 55% of unintended pregnancies among adolescent girls aged 15 to 19 years end in abortion, which are often unsafe in low and middle income countries or LMICs. Why this is because a problem, because pregnancy-related complication are leading cause of the mortality among adolescent girls. It also hinders their progress into adulthood and impact their education and economic prospects also. We see higher rates of adolescent pregnancy in rural area with limited access to parental care, it making it a critical issue to address. About that reason or that problem, our research had three main objectives. The first one is to determine the factor that contribute to adverse pregnancy outcomes in adolescents. And second is to investigate whether childbirth before age 20 correlates with higher incidence of adverse maternal and neonatal outcomes. And the third objective is to examine the evidence regarding specific risk factor linked to adverse pregnancy outcomes. The methodology that we use from this review study To conduct this review study, we use the PICO framework, which stands for Population, Intervention, Comparison, and Outcomes. The population of this study are adolescent pregnant women aged 10 to 19 years. Intervention that we do are analysis of elements such as educational deprivation, dietary inadequacies, substance abuse, use, and social determinant. And the comparison is the comparison are older pregnant individuals or adolescent without identified risk factors. And for outcome, there are two outcomes from this review study, which are the first outcomes is maternal outcomes, consists of anemia, preeclampsia, eclampsia, obstetric hemorrhagic, depression during pregnancy, premature rupture of membrane or PROM, prolonged labor, and miscarriage. And the second outcome are perinatal outcomes, consists of neonatal with low birth weight, prematurity, low Apgar score, infection, stillbirth, and neonatal death. This PICO analysis help us to structure our research question and identify relevant studies. For the inclusion and exclusion criteria that we use for this review study, the inclusion is we include studies involving pregnant women aged 10 to 19 years with unfavorable pregnancy outcomes, and then journal publication from year 2020 to 2024, and then article published in English, and the original research article. For the exclusion criteria, we exclude article published outside this time frame and thus not fully accessible for download. And then the screening for the article. For the methodology of screening the article, to streamline the reference management and screening process, we utilize Ryan software. The literature research was conducted across 3 major databases, which are PubMed, Google Scholar, and ScienceDirect. To depict the flow of information throughout the stage of the systematic review, we employed the Prisma diagram. Initially, we identified 1,103 articles, 151 from PubMed, 816 from Google Scholar, and 136 from ScienceDirect. After importing this into Ryan, we detect and remove 140 duplicate entries. Of the remaining 963 articles, 847 were excluded based on title and abstract screening due to not meeting the inclusion criteria. Subsequently, from the 136 full-text article assessed for eligibility, 121 were excluded due to low relevance or because they were still in the submission or acceptance stage. Ultimately, 15 articles met all eligibility requirements and were included the final of review. Next. The next step is our data extraction. After article screening, we extract relevant data from the select article, focusing on study design, population characteristic, outcomes, and risk factor. As presented, each entry includes the authors and publication year, the country of origin, the article title, the study objective, the sample size, the research methodology, and the key finding. Okay, the next step is the result of our review study. We analyze by risk of bias. Following data extraction, we conduct a risk of bias assessment for a study using the GBI critical appraisal tools. The analysis revealed that 13 studies, or 86%, demonstrate a low risk of bias, while the remaining 2 studies were categorized as having a moderate risk of bias. And then in terms of geographic distribution, the majority of the studies originated from Asia with 8 articles in total, 1 each from Bangladesh, Nepal, Iran, Indonesia, and Malaysia, and 2 articles from India. From Europe, there were 4 studies, each from Spain, Romania, Poland, and Slovakia. 2 studies come from Africa, specifically Somalia and Zambia, while 1 study was conducted in Canada, representing North America. Next. And then we do analyze by year of publication. The distribution of articles based on their year of publication indicate that the majority were published in 2020, accounting 5 articles or 33%. This suggests a heightened research interest or output in that year, possibly influenced by increased global focus on maternal health intervention during or shortly after the onset of the COVID-19 pandemic, I think. In 2023, there was also a notable number of publications, which is 4 articles or 27%, reflecting ongoing research activity in recent years. And then the number of studies published in 2022 was slightly lower with 3 articles or 20%. Publication declined further in 2024 with only 2 articles or 13%, and the fewest articles were published in 2021 with just 1 article or 7%. This may reflect publication delays, shift in research focus, or data availability issues in that year. Overall, this temporal distribution highlights its continued interest in the topic over time, with peaks in 2020 and 2023. And then we also analyze by type of study design. The majority of studies include in the review utilize a retrospective cohort design, accounting for 8 articles or 53.3%. This prevalence suggests a strong reliance and previously collect data to explore outcomes, likely due to the efficiency and accessibility of exciting health records in maternal health research. And number 2 is cross-sectional study, where the second most common comparison for article. The studies provide a snapshot of variable at a single point in time and are often used to explore prevalence of or association. And then prospective cohort study were less frequent with only 2 articles, indicating fewer studies follow participant forward in time. Finally, there was just 1 case control study, suggesting limited use of this design in the context of the review topic. This distribution highlights that retrospective data analysis remains a favored approach in the field, potentially due to research consistent or ease of data collection. The next step we do for our review study is making thumb grouping, which can see in the presentation. We grouped our finding into themes to better understand the pattern and relationship between factor and outcomes. Our themes are adverse pregnancy outcome, which include maternal and perinatal outcomes, and risk factor that contribute to adverse pregnancy outcomes in adolescent. Okay. The first outcome that we describe now is maternal outcome, that is anemia. Anemia was reported in 4 of the review study, highlighting its significance as a common maternal health issue among adolescent pregnancy. The finding consistently indicate that adolescents are at the higher risk of developing anemia compared to adult pregnant women. This heightened vulnerability is attributed to several contributing factors, including inadequate dietary iron intake, increased iron demands during periods of rapid physical growth, blood loss, and impaired intestinal iron absorption. This physiological and nutritional challenge place adolescent mothers at risk for severe maternal complication. Specifically, anemia has been linked to an elevated risk of obstetric hemorrhage and preterm birth, both of which can lead to adverse maternal and neonatal outcomes. Therefore, addressing anemia through early screening, nutrition education, and appropriate supplementation is crucial in improving pregnancy outcomes among adolescents. And the second one is preterm delivery. Preterm delivery, defined as childbirth occurring before 37 complete week of gestation, was identified in 6 studies included in this review. This outcome is notably prevalent among adolescent pregnancy due to several age-specific vulnerability. Risk factors particularly relevant to this population include physiological immaturity, inadequate prenatal care, and nutritional deficiencies, all of which compromise the mother's ability to sustain a full term of pregnancy. The consequences of preterm birth are significant as it is strongly associated with increased risk of respiratory distress, neurological complication, and long-term developmental challenge in neonates. These findings highlight the critical need for target intervention, including early perinatal care and nutritional support to reduce the incidence and impact of preterm delivery in adolescent mother. And the next outcome is labor complication. We found that labor complication were frequently noted across the review study, particularly in adolescent pregnancy. Obstructed labor, identified in 3 articles, often result from a mismatch between the size of the fetus and an underdeveloped maternal pelvis, a condition more common in younger mothers. This disproportion frequently necessitates cesarean delivery to prevent further maternal and fetal complication. Obstetric hemorrhage, discussed in 2 articles, was reported as a serious complication arising from causes such as uterine atony, placental abnormality, or trauma during childbirth. Additionally, prolonged labor should less frequently quantified post-special risk, including maternal exhaustion, infection, and in severe cases, uterine rupture. Next. The next is additional complications. Several additional complications were identified in adolescent pregnancy. Each report into article, miscarriage and stillbirth were among the major adverse outcomes, potentially linked to inadequate prenatal care and physiological immaturity in young mother. Similarly, the incidence of preeclampsia and eclampsia, which are hypertensive disorder of pregnancy, was notable. This condition pose significant risk to both maternal and fetal health if not promptly managed. Premature rupture of membrane or PROM was also highlight increasing susceptibility to bacterial infection and potential preterm delivery. Adolescent mother may be more vulnerable to PROM due to cervical insufficiency and genital tract infection. In addition to physical health risks, physiological complications such as depression and anxiety were also prevalent. These mental health issues were reported to occur at higher rates in adolescent mothers compared to those aged 20 to 34 years, possibly due to the social stigma, lack of support, and greater emotional instability. Collectively, these findings emphasizes the multifaceted vulnerability faced by pregnancy adolescents and highlighting the need for comprehensive obstetric and mental health care tailored to this age group. And the next presentation will be delivered by my partner Karita. Please, Karita.
Okay, thank you, Mbak Prima. I will continue the presentation for the perinatal outcome. Okay. Adolescent pregnancies are associated with increased risk for both mothers and their babies. Studies show that adolescents have a 1.36 times higher likelihood of experiencing adverse perinatal outcomes compared to mothers in the 20 until 24 age group. Firstly, limited fetal development time often leads to preterm birth, which carry a range of complications for the newborn. Additionally, maternal nutritional deficiencies are common in adolescent pregnancy, as young mothers may struggle to meet the increased nutritional demands of both their growing bodies and the developing fetus. Another significant factor is the ongoing maternal growth, which competes with fetal needs. Adolescents are still physically developing themselves, which can create a challenge in adequately supporting fetal growth. And then lastly, structural immaturity of the adolescent's reproductive system increase the risk of complications during labor and delivery, making it more difficult for the body to handle the physical demands of childbirth. These factors highlight the unique challenges that adolescent mothers face, underscoring the need for targeted prenatal care and support to ensure better outcomes for both the mother and her baby. And then adolescent pregnancies are often associated with additional complications that can significantly impact the health of the newborn. Several studies show that babies born to adolescent mothers are at a higher risk of various health issues compared to those born to older mothers. One of the most common complications is low Apgar scores within the first minute of birth, which has been reported in 5 studies. And then another complication is that infants born to adolescent mothers are more likely to be small for their gestational age, as found in 3 studies. Additionally, congenital malformation are more common in infants born to adolescent mothers, according to 2 studies. There is also a higher incidence of neonatal death among babies born to adolescent mothers, as found in 2 studies. Babies born to adolescent mothers often require resuscitation at birth due to complications such as respiratory distress or low oxygen levels, which necessitate immediate intervention to ensure the baby's survival. Lastly, higher rates of admission to neonatal intensive care units are observed for infants born to adolescent mothers. This is due to the increased risk of prematurity, low birth weight, and other health issues that require specialized care after delivery. And then risk factors. First, early marriage brings with it a multitude of consequences that deeply affect young girls, limiting their opportunities and well-being. These effects are not just immediate but can have lasting impacts on their future. One of the most significant consequences of early marriage is interrupted education. Once married, many adolescents girls are expected to take on the roles of wives and mothers, often leaving little to no time for continuing their education. This leads to an early end to their schooling, depriving them on the opportunity to pursue higher education or career goals. Without an education, their future economic opportunities are severely restricted, trapping them in a cycle of poverty. And then economic dependence is another critical consequences of early marriage. And then reduced decision-making power, social isolation, and limited knowledge about reproductive health. Next, adolescent pregnancies in low socioeconomic settings are often accompanied by a range of challenges that significantly affect the health and well-being of both the young mothers and their babies. The impact of low socioeconomic status is far-reaching, affecting access to essential services, education, and overall life opportunities. One of the most significant effects of low socioeconomic status is the limited access to healthcare services, and then inadequate nutrition, difficulty obtaining reproductive health information, poor understanding of adolescent pregnancy risk, limited contraceptive access, and financial barriers to prenatal care. And then the risk factor of educational deprivation. Educational deprivation associated with limited reproductive health knowledge, reduced employment opportunities for the young mothers, school dropouts due to pregnancy-related shame and stress during pregnancy, and then increased risk of early marriage, reduced capacity to make informed health decisions. And then poor nutritional status. The impact of poor nutritional status, approximately 20.2% of mothers experiencing wasting before pregnancy, 23.5% of mothers with height 150 centimeters, 26.1% with low mid-upper arm circumference, micronutrient deficiencies, and reduced capacity to support fetal growth. And then the next risk factor is psychological and social pressures, includes physical violence experiences, social stigma, vulnerability to depression and anxiety, stress related to adapting to motherhood, family pressure, community expectation, and limited social support networks. And then additional contributing factors. First, detrimental behaviors during pregnancy. We found it into articles. There are nicotine abuse and smoking, substance use, unhealthy dietary patterns, and lack of physical activity. And then the disadvantaged social environment, we found it into articles. First, disadvantaged ethnic groups, and then urban slum settlements, communities where early childbearing is normative, and then substandard antenatal care quality in one article. So for the conclusion, I will present by Mbak Prima.
Thank you, Karita. Okay, to conclude this review article, adolescent pregnancy is strongly associated with a higher risk of adverse pregnancy outcomes. It is not due to a single cause, but rather a combination of multiple risk factors that interact with one another. This includes lack of education, and then psychological and social stress, low income, poor nutrition, harmful behavior during pregnancy, living in disadvantaged environment, and inadequate antenatal care. This risk is especially high in girls under 15 years old, making early intervention and comprehensive support system absolutely essential. The next is our recommendation. We make a recommendation from this review study. Based on our findings, we recommend several key actions to address adolescent pregnancy risk. First is to improve access and use of maternal health services for adolescents. And second, implement targeted sex education and contraceptive program across families, schools, and primary health clinic is substantial. And third, health system should ensure timely referrals of pregnant adolescents to specialist care. And the next, we must strengthen physiological support service for young mothers. In addition, educating parents and school about the consequences of teenage pregnancy is a crucial thing. Finally, addressing the root cause like poverty and inequality requires collaboration across multiple sectors. That's our presentation today. Thank you for your attention. We are now happy to answer any question you may have. Thank you very much. It's time we come to back to Izza.
Okay. Yep. Okay, thank you so much, Karita and Prima, for your presentation. We already have 49 participants in here. Yep. Yep, really excellent presentation. Yep, real wonderful and thoughtful for me. So anyone want to ask some question, you can raise hand or just turn on your microphone and put down your question in the chat box.
Okay, they won't be able to unmute themselves. They'll need to put their hand up, and then we can, or you can unmute them.
Okay, Liz, got it. So yeah, we have Sada Sadiq.
Yeah, hello. Good morning. Happy International Day of the Midwife to all of us. That was a great presentation. I'm quite passionate about adolescent health. I'm a midwife from Ghana. I actually have an NGO that addresses such problems, especially when it comes to the preventive part. So through education and all that. One of the problems that we see, I mean, this presentation is a great one. I really love it. One of the problems that we see in Ghana when it comes to addressing most of this issue is culture and religious perspective. Are you having the same at your end? Or because I didn't really see a touch on it when it came to like the challenges, unless I missed it. But I don't know if we have people who encounter that and how they are solving it. Because a lot of our religious belief, which is when it comes to Christianity and Islam, frowns on sex before marriage. But unfortunately, we have some of our adolescents going into it and ending up being pregnant, though some are through abuse and all that. But at the end of the day, they come out as little mothers. I call them teen moms, and we need to handle these situations. How are other people handling their social, their culture and religious factors in respect to adolescent health? Yeah, thank you.
Yep. You got it the question, Prima and Karita?
Miss Izza, but I think Miss what name tadi? If I can answer with Indonesian, can I answer, Kak Izza? Because
Oh,
maybe
yeah. Please go on. Yeah, I will help you.
yes. Jadi mungkin nanti minta tolong ditranslatekan ya Kak Izza. Tadi mungkin dari pertanyaannya Miss Sada ya dari Ghana mempertanyakan apakah ada apa namanya correlation dengan agama gitu ya di studi ini. Kebetulan karena kami apa namanya artikel yang kami temukan itu dari berbagai negara, jadi ada 15 artikel, kebetulan tidak fokus pada satu agama, jadi di beberapa artikel tersebut tidak meng-highlight atau tidak ada faktor agama yang muncul yang dapat mempengaruhi kejadian kehamilan pada remaja seperti itu. Namun khususnya di Indonesia sendiri gitu, di negara yang mayoritas beragama Islam, hal ini pasti akan berpengaruh. Namun untuk kajian atau artikel yang focusing terhadap agama atau apa namanya budaya dan agama gitu, artikel tersebut belum kami temukan seperti itu. Tapi hal ini pasti akan berpengaruh terhadap kejadian atau angka kehamilan pada remaja, di mana pada agama Islam, kemudian agama Islam kan pasti akan ada larangan ya untuk berbuat atau apa namanya melakukan hubungan seksual sebelum nikah. Seperti itu. Makanya pendidikan seksual sebelum menikah pada remaja di sekolah di keluarga itu sangat penting agar mereka menjaga diri mereka untuk tidak melakukan hubungan seksual sebelum masa nikah tersebut. Mungkin itu Kak Isa. Thank you for your help for
Yep. Okay, got it. So Sada, and all the participant, I will help Prima to translate their explanation. So Prima mentioned that the previous or the prior research doesn't highlighting about the region and also some culture in a married adolescent. But in Indonesia, we have the huge majority of Muslim Islam. So maybe it will be interesting to conduct the next research about what the correlation between unmarried pregnancy in adolescent and earlier marriage for really teenager in the next maybe couple of years about that. And they believe that in Islam itself, unmarried pregnancy really need to have the good reproductive relation before they doing some sex or the other to prevent this condition. Yeah, maybe these details answering. Yeah, okay, thank you, Sada. And let's have a look in that time. Maybe one question more. Okay, I don't see any question. Oh yeah. We have Josie in here. Yeah. Okay. Yep, Josie, you already unmute, so you can give the question directly to the speaker.
Okay, thank you, Mbak Izza. Allow me to introduce myself. I'm Josie from Indonesia. I truly appreciate the excellent and informative presentations regarding the policy and intervention strategy. What recommendations are there to prevent adolescent pregnancy and improve outcome? Um, Perhaps earlier, Karita and Prima have already explained some recommendation, but could you elaborate on them further? Thank you.
Got it. Prima and Karita? Yep, you can answer the question. You get it?
Okay, thank you, Mbak Izza, for the time for me to answer the question from Kak Josie. So the recommendation, for to prevent adolescent pregnancy and improve outcomes. So the recommendations include enhancing adolescent-friendly health services, providing comprehensive sex education in families, schools, and healthcare settings, and ensuring access to contraceptions. Also, health systems should implement rapid referral pathways for pregnant adolescents and strengthen psychological support services. And additionally, multi-sectoral approach are needed to address root economic issues such as poverty, early marriage, and lack of education. So I think that's the answer for the question.